Hello and welcome to your COVID-19 update for today, Monday, March 21, 2022.
Over the last 24 hours, we didn't have many cases. We had actually one new case that was recorded, but the amount of tests that we did was about 300. So generally, we are seeing a decline in cases, but we're also seeing a decline in people coming to get tested. However, we still have 140 active cases, and so we continue to monitor these active cases. Of the 140 active cases, we have 14 who are currently in hospital, 10 at Ocean View, and of the 10 that are at Ocean View, we have 4 in the ICU. So we're still seeing persons who would need hospitalization, and in some cases, they're still having severe COVID, which requires them to be in the ICU. We have had 437,152 first doses administered for adults. That's about 85.2% of the adult population. And second doses are 334,899 doses. That's about 65.3% of the adult population. In terms of adolescents, that has been kind of stopped for a while. And so we're right now at 34,176 doses, or 46.9% of that age cohort, 12 to 17. And second dose, it's at 24,813, or 34% of that age cohort. Booster doses, we are now at 56,174 booster doses. And again, this is really a relatively small amount of people. Again, if you're going to remain protected, you have to get not just the primary doses, dose 1 and 2, but you should get your booster doses as well. I wouldn't say that the guidelines have been dropped, but people now have more independence in terms of determining what they do. That independence now it's up to you whether you want to wear a mask or not. So it's optional, but you have to look at your risk and you have to decide whether you want to take precautions. So there's an individual responsibility. Working places, business entities, different spaces can also decide whether they want certain rules in place and work with those, because as you can see, we still have active cases in Guyana. We have 140 active cases. It's going down, at least for now, but we still have active cases, and those persons can very easily infect others. So we still have to be cautious because not everybody has been vaccinated, so not everybody would be protected. So we need to be cautious, and there's still a lot of unvaccinated people out there. And if you're unvaccinated, there is a chance that you can get the more severe form of COVID, because as we're seeing, the people who are coming into the hospital are basically unvaccinated people. The people who are ending up in the ICU are unvaccinated. So if you're not vaccinated, you still have a chance of getting the severe form of the infection. So I think people still need to be a little cautious, but this is their independent or they have to exercise individual responsibility.
You have been watching the daily COVID-19 update for today, Monday, March 21, 2022. I'm Natasha Smith-Thomas. Goodbye.